Hello again. In the last video, we gave you a little brief overview of what the course was going to be about. And in this video, I'd like us to start thinking about what public health is and what it means to start to think like a public health professional. And so I want to start with some questions. So for example, Joe drinks one night, crashes his car, breaks his leg, his arm, a few ribs. He doesn't have any health insurance. Should he have a right to treatment? So should he be able to show up at the hospital and be able to be treated for his injuries? And if so, who should pay for that? Beth smokes a pack of cigarettes each day. Do you think she'll get lung cancer later in life? What are you basing that on? What makes you think that that's true? There's knowledge out there that we have, but how did we come to acquire that information? Here are two pictures of two very different communities. How do you think these neighborhoods differ in terms of their health? In what ways do you think the physical and social environments are impacting how they eat, whether or not they exercise, what they do for recreation, and how all of those things impact their health? And a black woman with a college degree is more likely to have a low birth weight infant than a white high school dropout. How is this possible, and what can we do about it? And, just as importantly, why should you care about any of this? This is an introduction to public health. In this course, I'm going to invite you to think about which health problems are likely to affect you or the ones you love, and how public health can have an impact on your community and therefore your life through an examination of current events, some documentary films, case studies, online course discussions, and an array of other activities. So again, what is public health? Let's see, hopefully this link will work.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduce prevention and early detection activities that help increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution, and the Flint, Michigan lead crisis taught us the dangers of our aging water system. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHS as we create the healthiest nation in one generation.
So as you saw in the video, there are a lot of aspects to public health. And it's been defined as, by George Vickers, the history of public health might well be written on the record of successive redefinings of the unacceptable. And this is one of the definitions that I truly enjoy, because it really is about how does public health, or how do we think about public health over the years? So a life expectancy in the 1900s, which was significantly shorter than it is now, was at the time acceptable. It's what people did. But we kept pushing that. We no longer expect to die from cholera or from mass outbreaks of influenza and pneumonia. We expect to be able to survive those things. And so now we have a successive redefining of what's acceptable and what is unacceptable. And as the former Surgeon General C. Everett Koop said, healthcare matters to all of us some of the time, but public health, whether or not you realize it, matters to all of us all of the time. And this is a little bit older now, but generally when people are asked what the term public health means or what they think of, this is what happens. Most people think public health means just government-provided healthcare system for all and healthcare for the poor. Some individuals believe that it means policies and programs that help maintain healthy conditions, and a smaller percentage say protecting the public from disease. Public health is all of those things and more. As you saw in the video, public health is the science and art of preventing disease, prolonging life, promoting physical health, and efficiency through organized community efforts for the sanitation of the environment, the control of community infections, the education of the individual in principles of personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and the development, and this is probably one of the most important parts, of the social machinery which will ensure every individual in the community a standard of living adequate for the maintenance of health. So it's really the science and art of preventing disease, promoting life, promoting physical health, and it's all through organized community effort. And so when we think about what public health is, again, these are activities that society undertakes to assure the conditions in which people can be healthy include organized community efforts to prevent, identify, and counter threats to the health of the public. The health status and conditions influence the health of a category of people, and the health status and conditions influence the health of individuals, whether or not they define themselves as a community or not. And so when we think about public health, there's two terms that often come up: population health and community health. And these are slightly different. So population health talks about categories of individuals. So adolescents, men, women, individuals with disabilities. Populations can be defined by race, by age, by gender, by sexual orientation, etc. Now, everybody who's in that category is a part of that population, but they may not define themselves as a community. Not all college-age students are friends with each other. Community health is about communities, individuals that come together voluntarily, either through where they live or religious communities, etc., that share certain behaviors. And so we tend to use those terms interchangeably, but it's important that you know that they mean somewhat different things. When we talk about the study of public health, there are 5 core disciplines: epidemiology, biostatistics, health policy and management, social behavioral influences on health, and environmental health. I'm going to talk about each of these because it's important you know what they are. If you are a public health major, you'll be expected to take courses in each of these areas. In addition, according to the Association of Schools of Public Health, which we use for our program, there are a number of what are called cross-cutting disciplines. This includes things like professionalism, health communication, health disparities in social justice, and several others, including informatics. And the undergraduate degree also offers courses in each of those areas. Epidemiology is considered the science of public health. Epidemiology is the study of patterns of disease and injury in populations, and the idea is that we study these things in order to be able to control those health problems so that we can better understand how to prevent disease and injury. So in one of the first slides, I talked about Beth smokes a pack of cigarettes a day. She may end up, do you think she's going to get lung cancer and why? And we know that through research done by epidemiologists. There was a time when they did not think there was an association. Nobody even thought there might be an association between smoking and poor health. But researchers studied individuals who smoked and those who didn't and followed them in time and started to recognize there was a pattern of increased risk associated with smoking. So we'll talk a lot more about epidemiology and the study of epidemiology. Biostatistics, this is the one that tends to give our students a bit of pause. And this is really the math. So we have the science of public health and we have the math of public health. And in biostatistics, you apply mathematical models or reasoning and methods in order to analyze those research studies, to look at what's happening in public health. What is the impact? Is healthcare actually being successful? Are we reaching the outcomes that we think we are? When we're looking at, in this case, population-based research. And so we will be doing some biostatistics, there will be some math, but rest assured, it's mainly addition, subtraction, multiplication, and division in this course. So you will be able to do it. Next, we have health policy and management. And this is actually a fairly broad field that is often studied in conjunction with each other, but also somewhat separately. So there's health policy and health management. And this is a multidisciplinary field of inquiry, and it looks at how we deliver healthcare, the quality of healthcare, the cost of healthcare, and how healthcare is run. So in health policy, you think about things like, as seen in the video, car safety. How do we regulate car safety? Well, seatbelt laws, limits on speed limits. We look at things like maximum blood alcohol levels for when you're driving, laws that influence how people behave, which ultimately influence health outcomes. Health policy is also looking at how we deliver healthcare in the United States as well as in other countries. So Medicaid, Medicare, private health insurance, public health insurance, which includes now the Affordable Care Act as well to an extent. Health management is also how do you determine quality and delivery? And so several of those people will work in areas like hospital management and management of private programs. Social and behavioral influences on health is a very big part of public health. And this looks at what we now call the social ecological model. So it's that influence of individual behaviors on society and the influence of society on individual behaviors and how they're interconnected and how this can determine, again, your zip code where you live. All of those influences will determine what diseases you are going to come in contact with, what chronic diseases you might develop, and how health disparities develop over the life course. And the research and practice in this area contributes to the development, administration, and evaluation of programs and policies in public health. And it's a very important part. It's a big part of what we do in this program. And finally, we have environmental health. And environmental health, people tend to think of as sort of the biological chemical factors, so things like water pollution and air pollution, which are very important. But we also like to think of it as the physical environment. So when you come into University Hall, for example, there's a grand staircase that people tend to use. And if you look in other buildings that don't have a large, welcoming staircase, people tend to use the elevators. And so slight changes in your physical environment can change how you act and can ultimately change your behaviors and your health. Okay, yeah, but what is public health? Well, public health is in the news every day. If you pick up a newspaper or online, you'll see stories about the news, whether it's Flint, Michigan, the current proposed changes to health insurance in the United States, influenza outbreaks, HIV, terrorism, etc. These are all aspects of public health. And the interesting thing about public health is public health protects you and keeps your loved ones safe and healthy every day, day after day, in ways you don't even necessarily think about, especially in this country. The nation's public health systems continues to provide proper waste disposal and, in most cases, unlike Flint, safe drinking water. And these are prime examples of how public health, which takes care of entire communities, is different from personal health services, which takes care of one person at a time. Public health works to keep the entire populations healthy, and when it fails, entire populations suffer. After you arose this morning, did you brush your teeth? Floss? Hopefully you did, and hopefully you go to your dentist regularly to follow the directions to keep your health and gums healthy. This is important personal health care. But public health also keeps your teeth healthy. Fluoridation of the public water system, which began in 1945, is considered a major public health accomplishment. It resulted in about a 40 to 70% reduction in tooth decay in children and a 40 to 60% reduction in tooth loss in adults. However, about 40% of the U.S. population still live in areas without a fluoridated water supply. Did you have breakfast today? Did you have orange juice or perhaps scrambled eggs or maybe a bagel with cream cheese? The only reason you can be fairly sure that your juice, eggs, and cream cheese are not contaminated with bacteria that would make you sick is that public health regulates the safety of your food supply. We also teach and promote safe food handling practices that kill bacteria and help you and those who handle your food not contaminate it. Sometimes, despite everybody's best efforts, outbreaks of disease caused by contaminated food occur. The public health system then does detective work to find the sources of the contamination and stop it. We apply the methods of epidemiology to learn what the sick people have in common and locate the source of contamination. Then we make sure that all the contaminated food has been removed from the food supply. If you had breakfast, did you have cereal? If you're a woman who might become pregnant, your cereal, fortified with folic acid, will help prevent some serious birth defects. Folic acid supplementation and things that you eat every day, like cereal, is an important public health measure to prevent birth defects. After you had your safe and hopefully healthy breakfast, maybe you or your neighbors or family members sent children off to a daycare center or school. It's the public health system that works to make sure that children are fully immunized so that they cannot catch or transmit measles, whooping cough, diphtheria, polio, or other childhood diseases that are killers when they go to school or daycare. We are all too young to remember a time in the early 20th century when tens of thousands of children died or were permanently disabled by diseases. These days, the numbers of people who contact vaccine-preventable diseases are about 95 to 100% fewer than before vaccines were available. And this prevents things like pertussis, which is also called whooping cough, congenital rubella, and other diseases. And when you look at that, as a result, we've seen a dramatic change in the leading causes of death. So in 1900, the leading cause of death was influenza and pneumonia. So about 202 202 people per 100,000 died from influenza. Now, while it's still in the top 10 of leading causes of disease, it's changed. So by 1950, the leading cause of death was heart disease, and thanks to public health efforts, that number has come down by almost half. And so here's another way of looking at it. So this is influenza, and you see there was a spike in 1918 with one of the deadliest influenza pandemics in modern history. But very few people, or relatively few, are dying of that. Heart disease likewise peaked and has now started to reduce. And when we look at vaccine-preventable diseases, we have globally eradicated smallpox due to vaccines. And in the United States, polio has been eradicated. And I believe it's now been eradicated as of the end of last year worldwide. Again, due to vaccination efforts. So it's important that despite the fact that many of us have never had to worry or seen an outbreak of smallpox or polio, to maintain those vaccine rates so that we don't have that. And there have been outbreaks of things like measles and mumps in small populations where people have chosen not to be vaccinated. And we'll talk about that more later in the course. Did you drive today? Have you gotten in a car? If so, did you buckle up your seatbelt? Motor vehicle safety is not just a transportation or law enforcement issue. It's also a public health issue. Public health works hard to promote the use of seatbelts, child safety seats, and motorcycle and bicycle helmets, all of which prevent deaths from injury. And we have seen significant reduction in childhood death and injury due to proper use of car seats, seatbelts, and bicycle helmets. When you arrive at your office building, or if you come to campus for a course, it probably doesn't even cross your mind that nobody's sitting in the middle of class smoking, or sitting in your office just whipping out a cigarette or smoking, or even these days smoking in restaurants. Decades of public health research and action have led to our knowledge that tobacco use kills, and many actions have been designed to reduce smoking, including clean indoor air regulations, and in many cases clean outdoor air regulations, which limit where you can smoke in and around public buildings. Do you like to go out to eat in restaurants? Well, the public health system has established sanitation standards for restaurant kitchens, and health departments inspect them. They close down restaurant kitchens that aren't up to code, and we can all be reasonably sure that our lunch won't make us sick because of public health. Are you planning to go to the gym today? Well, that's good for you. Public health research has demonstrated the benefits of exercise and weight control in preventing the huge toll taken by heart disease, diabetes, and stroke. The entire public health system is working to address the problems of obesity and physical inactivity. And this is one of the great public health challenges for the 21st century. Public health has also taken on another new role for the 21st century. We've all heard about the possibility that terrorists will use biological weapons. The public health system has been working overtime since 9/11 to prepare for such horrific possibility. We're improving disease detection and communication, training our workers, and conducting exercises, much like the military, to test our readiness to respond. We all hope that an act of bioterrorism never occurs. Nevertheless, what we are spending today to prepare the public health system will not go to waste, even if biological weapons are never used against us. It does not really matter whether an outbreak of a dreadful infectious disease is caused by the intentional release of anthrax spores, or whether it is caused by a new virus that mutated from avian flu virus, and about which public health's worry now. Public health response will be similar, and we will be ready. And so we look at, again, this influenza 1918 outbreak to try to understand, well, how do we deal with another influenza outbreak? So at one point it was bird flu. About 8 years ago it was swine flu. And thinking about, okay, how do we deal with that? When an outbreak occurs, what do we do? And there are now very well thought out, detailed plans that are in place. So what is the public health system? Well, it consists of both government agencies and private entities. Federal agencies and state and local government agencies all work in partnership to provide leadership in preventing disease and promoting the health in the entire nation, state by state and locality by locality. Governmental agencies have certain regulatory powers to protect the people that no other entity has, but it can't do it alone. It needs to work with private institutions and private individuals and nonprofit organizations to implement the work that we do. In every community, hospitals, health centers, schools, doctors, nurses, dentists, clinical laboratories, businesses, and many others all have important roles in preventing disease and protecting the health of their communities. And a big part of public health is prevention. As you've heard the old proverb, an ounce of prevention is worth a pound of cure. And we know that public health measures don't just save lives, they also save money. For instance, for every single dollar spent for elderly immunizations, we save about $2.21. But for every dollar spent for childhood immunizations against things like diphtheria, tetanus, and whooping cough, we save $27 in direct medical costs. Every individual, every constituent expects that the public health system will continue to protect him or her and their families. And I've shown you many ways that public health fulfills this mission in ways so invisible that few people outside public health even notice, and therefore it tends to be taken for granted. As was said in the video, there are a number of unique features of public health. And this includes a grounding in science. So there are people who make that transition from bench and basic sciences to the social sciences and epidemiology. So we really understand the diseases that we're working with. There's a strong focus on prevention. And we'll talk about what that means and what the levels of prevention are. As said in the video, we have a very strong social justice perspective, meaning that there's an emphasis not just on equality, but on equity in terms of services and an desire to reduce health disparities. Because of this, the public health system is a partnership between government and private entities. It is inherently political. And if you've been paying attention to the news, you can see just one aspect of how that's political. The healthcare system and the changes that are being proposed and the recent changes, or relatively recent changes, in the implementation of the Affordable Care Act. But it's also inherently political in how we deal or how we fund the water system, our energy systems. When we look at zoning boards and planning and how that influences neighborhoods and the type of businesses that go into neighborhoods and how that ultimately impacts health. And so it's inherently political. And as I said, it's the successive redefining of the unacceptable, and therefore it has an evolving expectation and expanding agendas. Dr. David Williams said all policy is health policy, and in many ways that is true. And so we talked a little bit about what public health has achieved. And so when we look back, the 10 great public health achievements of the last century were considered things like immunizations, which have had a dramatic impact in causes of death and death rates. Motor vehicle safety, which continues in the 21st century to be a public health achievement. Workplace safety, things like child labor laws and what you can be exposed to in terms of chemicals at work and places to make sure that you stay saved. We've had declines in heart disease and stroke. We've had better control of infectious diseases, both through immunizations, but also through other public health measures. We have safer and healthier foods because of public health. We have healthier babies and mothers. So our maternal and infant mortality rates have dropped dramatically since the beginning of the 20th century. We've had improvements in family planning, fluoridation of water, and the recognition of tobacco as a health hazard. And this is what's been achieved, but there's a lot more to be done. Every 10 years, Healthy People is updated. And so we're now working towards Healthy People 2020. And I encourage you all to go to healthypeople.gov to explore how the government, the federal government's plan for improving public health. And there are now 4 goals in Healthy People 2020. The first goal is to have everyone attain high quality, longer lives, free of preventable disease, disability, injury, and premature death. And premature death is defined as any death before the age of 65. The second goal is to achieve health equity, eliminate disparities, and improve the health of everyone. And we know that when we reduce health disparities for those most at risk, everyone's health improves. So what benefits one group benefits everyone. Goal 3 is to create social and physical environments that promote good health for everyone. Again, if we improve the physical environment in a community, it does not impact one person, it impacts the entire community. It's a good investment. And to promote quality of life, healthy development, and healthy behaviors across all life stages, starting in prenatal and going all the way to the elderly. And so what can you do in public health? Well, there's a wide array of job opportunities, and there's actually a book called, I think it's 101 Careers in Public Health that we have in the department. But here's just a small list. Many of our graduates go on to be health educators, community planners. We have several students have taken this degree and partnered it with a nursing degree and become public health nurses, community nutritionists, we have first responders, social workers, and several who've gone on for advanced degrees and become epidemiologists and biostatisticians and scientists and researchers. And so there are a number of opportunities. And if you're interested in learning more about those, I encourage you to go to What is Public Health? You can Google that, it'll come up, or feel free to ask me or any of the other faculty in the program.